Dear students, so today I'm going to talk about acne vulgaris, one of the very important topic in dermatology, and it is very common disorder of adolescents and young adults. Now let's introduce the topic. This is a very common chronic skin disease involving blockage of and or chronic inflammation of pilosebaceous unit. So all the problem occurs in pilosebaceous unit in this case. Now see there, pilo means hair follicle, sebaceous unit means sebaceous gland. They are together. The opening of sebaceous gland, okay, or the discharge of sebaceous gland opens through hair follicle on the surface of the skin. So when they are affected, means when the sebaceous gland and hair follicles are affected, they are usually affected together. Okay, so this leads to acne. Now the term acne vulgaris means very common type of acne, okay, which usually occurs in those areas where sebaceous glands are maximum, like face, upper part of the chest, and the back. These are important one. Now it has varied type of presentation, which is characterized by comedone. There are two types of comedone, blackhead and whitehead. You all know because we have been talking about this from the very beginning. Blackhead means open comedone, whitehead means closed comedone. They are considered mild and early cases of acne. Papules or pinhead, pustules are also known as pimples, nodules, the larger papules, and finally, when this is severe type of nodulocystic acne, it can heal with scar formation. So these all are very varied or variable presentation in case of acne. Now look at this picture here. Okay, this is highly suggestive. Uh, this is, see that. Now this picture tells us where is the area for hair follicle and sebaceous gland. This is the one. Hair follicle is coming outside. Erector pili muscle is attached there. This is sebaceous gland. The discharge of sebaceous gland is coming out through the hair follicle opening. Okay, so this is the area. If it is affected, we call it acne vulgaris. Now this is a schematic diagram which is highly suggestive or typical of acne. See here, this is the blockage of the duct of sebaceous gland. Inflammation has already occurred. Infected sebum which is accumulated and that has caused distension of the gland. There is breakage of the hair follicle. Okay, so all these are very typical features of acne vulgaris. And remember, this occurs because of the androgen excess during puberty, which is the most common age, and after that there is excessive sebum production, and on top of that, if the opening of that duct is blocked, it can easily attract infection there. All these points are important in acne vulgaris. Okay, so let's restart after the break. We're talking about acne vulgaris. This is a very common disorder, especially in adolescent and young adults. Now, regarding the sex, this is more common in male in adolescent age group, but if adults suffer from acne, then it is more common in female than in male. There is a reason for this. Okay, now remember, what is the source of androgen in our body? The source of androgens, yes, what are the source of androgen in our body, guys? Anyone can answer this to me?
Adrenal gland and male and female both, and
Good. Yes, you already gave the answer. So it is adrenal gland and male and female gonad. Okay, male and female gonad as well as adrenal gland. Now, male gonad or testes produce large amount of testosterone. This is an important type of androgen, and androgen in male is also secreted by adrenal gland. Whereas in female, adrenal gland definitely secretes a little bit of androgen, But okay, some of the androgen can be secreted by ovary as well. But at the same time, if she develops any ovarian tumor, okay, which are called androgen secreting ovarian tumor, then suddenly there is a large amount of androgen in the body. So whenever a lady develops acne after the age of 25 years, we strongly believe there may be androgen secreting tumor or some disorder where androgen is excessively secreted inside her body. We'll talk about that, okay, when we talk about the etiology. Now, for most people, acne diminishes over time. Okay, it diminishes over time or it decreases over time and tends to disappear. For example, after we reach 25 or 30 years, okay, there won't be any acne remaining. But after that age, if it remains or if it comes back, that clearly tells us that androgen is being secreted at a higher amount because of some causes, and we need to find out what are those. We should take a family history. It runs in the family, and some acne are adult onset, which I already discussed. Now, with this information, let's talk about what are the causes of acne vulgaris. See there, hormonal causes. Okay, some of the hormones are very important one. The most important among all, androgen, as well as anabolic steroid if we take them from outside. Another disease is congenital adrenal hyperplasia, or CAH. Now, in case of congenital adrenal hyperplasia, okay, let me say a little bit about this because these are the important revision for you. Okay, in congenital adrenal hyperplasia, 21 hydroxylase enzyme is deficient most commonly. Another is 11 beta hydroxylase as well. So, because of this enzyme deficiency, okay, aldosterone as well as cortisol, aldosterone as well as cortisol cannot be synthesized. Aldosterone and cortisols are very decreased. Okay, they are very decreased. Now, what happens if they cannot be synthesized? Okay, if they cannot be synthesized, then those metabolite will undergo into androgen pathway or sex steroid or androgen pathway. So androgens are excessive in case of CAS. That is the reason for acne. Now, polycystic ovarian syndrome, also known as Steen-Leventhal syndrome, okay, Steen-Leventhal syndrome is another important cause of acne vulgaris in case of female. Steen-Leventhal syndrome secretes large amount of androgen. Now, what about the other causes? During pregnancy and during menstrual cycle also, there is slightly more secretion of hormone. So acne can become exacerbated that time. Some of the genetic causes are also responsible, but we really do not know what are those genes. So we call them polygenic. And it is very common in first degree relatives. For example, it runs in the family. Inside the family, if elder brother has acne vulgaris, the younger one has very high chance to develop. Even the other siblings can have the chance. Psychological are other causes. Okay, it is associated with increased stress, and this is a very known fact. Now let me explain this in some easy way. If you do not sleep well, okay, for example, tomorrow is your exam, tomorrow is your final exam, okay, or end semester exam, and you already are a patient of acne, you do not sleep. Okay, you sleep probably at 4 a.m., 5 a.m., or even 6 a.m., or you even don't sleep at all. The next day, okay, the next day or day after, you will definitely have more acne coming on the face. So this is strongly related with stress. Okay, so acne is exacerbated by stressful situations. Infections are other, like Propionibacterium acne and Staphylococcus epidermidis. The first one is more important bacteria. This is considered as a normal commensal, but when sebaceous glands are blocked, they can proliferate there and can lead to inflammation. Diet also play a role. High glycemic load diet is associated with worsening of acne. That means more sweet food. Okay, more sweet food. That is called high glycemic load diet. And milk consumption is also associated with severity of the acne. So those people who are having more severe type of acne vulgaris should cut down this type of diet. They should not drink a lot of milk, as well as the sweet food has to be cut. So these are some of the important points. Okay. Now let's move on. Let me delete this first. Okay. Now this is called acne tree. Okay. So have a look there. Okay. See there now. Now genetics factor play a big role. Okay. The person is already predisposed, whether that person will develop acne or not. Okay. So genetic factors are here. Those are the roots actually. Because of the androgen effect, there is excessive oil production already. Okay, this is the job of androgen. So sebaceous glands are already overactive. This is a very important point. Okay, the person should have hyperkeratosis. Now listen it very carefully. On the skin, especially the face, if we do not keep on wash our face, okay, those dead skin cell, or some people have excessive production of flaking, they can simply block the opening of sebaceous gland. Now all the problems start after that. Already they are producing more oil there, so this bacteria will be drawn or attracted in that area and it will proliferate. The name of the bacteria is Propionibacterium acne. Okay, and all these things will combine together and lead to inflammation. Okay, at the same time, if immune system of the patient is a bit weak and patient is under a lot of stress, that help in the development of acne. So this, most of the factors are described as a tree. So we can easily call it acne tree, which will tell us about the etiology as well as pathogenesis of acne. Now look at this slide here. Okay, it is also discussing the same thing. Okay, this just follow this here. Now see this. This is prepubertal sebaceous gland. Okay, it is relatively smaller in size and it is secreting sebum at its own rate, and the opening is not blocked. Now pubertal. Now there is a lot of androgen effect, and this androgen is stimulating the sebaceous gland to produce more sebum, and this sebum is coming outside. Till now no problem, because the opening is not blocked, the duct is not blocked, so no problem whatsoever. But all the problems start once this opening is blocked because of flaking or because of excessive keratosis. Now there is over distension of the gland, the bacteria will be attracted there. Okay, this bacteria will degrade the fatty acid product, okay, or the fat, and different irritants will be formed which will lead to inflammation. Okay, and once it reaches to a particular size, it will rupture, and this rupture is a very critical stage here, because this inflammatory substance will spread in the nearby area, and suddenly a large area is involved. It will form a big cyst, okay, pus formation, and even scar formation. So this is a severe form of acne. So these are the different stages. Now with this information, okay, let's go to the description once again. Acne vulgaris has a multifactorial pathogenesis, of which the key factor is genetics. Genetic factor play a big role. Those persons should already be genetically predisposed. Now on the top of that genetic factor, these four factors interplay with each other and lead to acne. So what are those? Okay, step by step. First one, clogging of the follicle by excessive epidermal proliferation. This is also known as flecking, which is blocking the opening of the gland. Second one, because of the androgen effect, already the sebum is excessively produced. Third, the bacteria will come into the picture now. Propionibacterium acne, the presence and activity of that commensal bacteria. And fourth, all these factors will combine together, which leads to inflammation. So if I want to describe a little bit more here, this propionibacterium acne will degrade, okay, different substances there, and those substances are quite irritating, which leads to inflammation. So these four factors are very, very important in pathogenesis of acne vulgaris. Now, different pictures are trying to explain the same thing once again so that you will not forget it. See there? So let me explain with the help of pointer again. See this. This is a normal skin, and this is the cross section of the normal skin. This is a hair which is coming out. This is called root of the hair follicle. Here is sebaceous gland which is doing its secretion, and it is coming outside nicely. Okay? So this is the top layer of the skin, which is called stratum corneum, and lots of flecking is formed here. It is constantly, getting off from the surface and replaced by the other new cells. Everything is fine here, but what is the difference with the skin which is having acne? Now look at all the differences here. Where is the opening? This opening is blocked now, and probably the hair is fallen, it is broken. Okay. At the same time, look at the size of this sebaceous gland. It is hugely enlarged. Okay. At the same time, these bacteria are there. Okay. And all the signs of inflammation would be present. Now, with this information, it's very easy for you to understand what are the clinical features of acne vulgaris. The local symptoms of acne may include pain, tenderness, and or erythema. Pain, tenderness, and or erythema. Now, it depends what is the severity of the acne. If it is very severe, there is pain, especially on the face, and when we examine, there will be tenderness. The systemic symptoms are most often absent in common type of acne vulgaris. Now, systemic symptom means fever, myalgia, all those things are absent in case of acne. But there are certain type of acne which are considered very severe form. Even the systemic signs and symptoms are seen. And one of that, a condition is known as acne fulminans. So look at the term, acne fulminans. Fulminans means severe type of infection. So in this type, even the fever can occur. Another type of severe acne is called acne conglobata. Acne conglobata, and that means multiple acne lesions are combined together. Okay, they are fusing with each other, and it is leading to a large lesion in particular area of our body. That is, of course, face, upper part of the back, and upper part of the chest. But this acne conglobata doesn't have systemic symptom. It just have very severe type of local feature. Okay, means bigger lesion. In comparison to the acne fulminans, there is no fever in acne conglobata. Please remember that. Now, what happens to this lesion? These severe forms of acne heal with disfiguring scar. They form very bad looking scar on the face. And this is a worrisome point regarding acne fulminans and acne conglobata. Now, that is a young person, remember, he is an adolescent or very young adult. So if they develop bad type of acne on their face, the overall self-esteem, the overall self-confidence is down. That person probably doesn't want to go in front of their friends. He or she may think, what other people think about me? So overall self-confidence may be low or down because of this effect. So they need a very good psychiatric counseling regarding this. It is not applicable to all. Okay, some all peoples are not same. Some people can think, oh, this is nothing, this is just, you know, one type of thing which is coming at this particular age. If I take medicine, it will disappear. People think like that as well, so their self-confidence is still not down. But some people are different, so they may suffer even from psychological impact. Let's move to the next slide. Now see here, what are the other findings in acne vulgaris? Now see there, comedone, okay, papules, pustules and nodules are very common feature of acne vulgaris. Now comedone can be black comedone and white comedone. Now black comedone means open type of comedone. Some of the secretions is already coming out, and they turn into slightly black in color. So we call it black comedone. White comedone means they are still not open. So other terms are very easy for you. Okay, the papules and pustules are raised bump with obvious inflammation, and the most common site is of course the face. But don't forget about upper chest, okay, upper back, and even the upper arms. Upper arms are not that commonly affected, but it can be seen in excessive form of acne. Now let's talk about different physical findings in case of acne vulgaris. This is the comedonal acne, okay, which is the, you know, most mild type of acne, I should say, comedonal acne. So if we see very carefully, okay, there are few lesions which can be seen. Comedonal acne. So already black and white comedone may be there. Okay, another one is a mild acne. This mild acne, let me use the pointer and show you. This mild acne is characterized by comedone and a few papulopustules. Now on top of the comedone, some papule and pustules are developed. So see this, here the lesions are a little bit more than the last picture. Okay, still a lot of comedones are there, and some of these comedones are infected, we call that pustules, and if they are a bit bigger, we call them papule. Now moderate acne, okay, it is getting more serious than previous picture. Still that person has got comedone, but more papule and pustules are present. Now I can clearly see these are called pimples. Now these pustules are called pimples. There are many papules as well, and the most severe variety is called nodulocystic acne. Now look at this area here, there is a big mass, okay, big area is involved, it looks like a cystic area. So this is nodulocystic acne, which is the most severe, and this person will always develop scar later on when this becomes better. Now there are some more picture which are showing the same. See this, this is a very close view or magnified view, a bit of bump here, okay, and if we squeeze, a lot of pus would come out, but let me warn you, you should not squeeze these unnecessarily. And this person has a very bad type of acne. See, like, look at the cheeks, okay, look at the forehead, okay, side of the temple, these all places are affected badly. Okay, now let's move on. Now look at this picture, okay, these are the different forms of acne. In one slide, all types of stages are shown. This is mild one, okay, mild one. This is moderate, mild to moderate, okay, still not that bad looking. But these three, okay, this is the worst actually. This is the worst one, okay, and these other two are also from moderate to severe. Moderate to severe. So these are the different clinical features of acne vulgaris. Now, what are the variants? Okay, what are the variants in case of acne vulgaris? Let's talk a little bit about that. First is classical acne vulgaris, which we are talking right now. Neonatal acne is one of the conditions which is seen in neonate after birth up to few days. Sometimes they may remain even up to 1 week or longer than that. Now, that neonatal acne is because of passage of hormones from the mother towards the baby side. Once the effect of these hormones are done, then acne will disappear. This is called neonatal acne. You don't need to do anything for this. Just wait and watch. It will disappear on its own. Now, drug-induced acne can be caused by ACTH or adrenocorticotropic hormone, danazole, cortisol, as well as testosterone. All of these have certain androgenic effect. Hormonal acne can be seen in Cushing's disease or Cushing syndrome and polycystic ovarian disease, also known as Steen-Leventhal syndrome. So another term for polycystic ovarian disease is Steen-Leventhal syndrome, where ovaries are having multiple cysts, and those cysts are secreting large amount of androgen. Another important presentation of Steen-Leventhal syndrome is obesity. Okay, these women or ladies are very obese and they are having hirsutism as well. They are having excessive hair growth on unwanted part of the body. Now, acne fulminans is another variant. Acne conglobeta is another variant. You can add there. Now, let me remind you once again. Acne fulminans means severe form of acne where there is systemic sign and symptom like fever. And acne conglobeta is multiple acne lesions are fusing with each other but without fever. Now, this is a picture of neonatal acne. You can clearly see these pimples here. Okay, neonatal acne. We don't need to worry about this. It will disappear within few days. Now, what complication can occur because of acne vulgaris or severe form of acne? They can form a bad scar, and those scar can be of two types: atrophic scar and keloidal scar. Okay. Now, actually, I can use another term also here, that is hypertrophic scar. So let's make it three actually: atrophic scar, hypertrophic scar, and keloidal scar. So let me explain a little bit about them. Atrophic scar means the scar is not elevated from the surface. Okay, rather than that, it is contracted and probably going downwards. Hypertrophic, it is inside the wound margin, but it is elevated from there. That is hypertrophic. And keloidal, it is going, here and there, all around the wound margin. It is almost like a tumor which is spreading from the central area. This keloid or keloidal scar is developed by genetically predisposed individual only. It doesn't occur in everyone. Okay, and the treatment is very challenging here. We do not go for surgery to remove the keloidal scar. Rather than that, you have to give corticosteroid injection. Now, another complication which we can discuss here is a psychological impact. I already told about this. Okay, because of that vulnerable age group, remember they are adolescent. Okay, this adolescent age group is psychologically a very vulnerable age, so they can have reduced self-esteem, reduced self-confidence. Okay, so all these features may be there. So good psychiatric counseling is a part of the treatment. And associated disease can be there, which are androgen secreting tumor. In case of female, one of the tumor which occurs in ovary is called Sertoli cell tumor. Okay, and PCOD is called polycystic ovarian disease. We can go for the treatment for these associated conditions. Now, what investigation you like to do in case of acne vulgaris? Now, this is a clinical diagnosis. Okay, this is a clinical diagnosis. For the diagnosis of common type of acne vulgaris, you don't need any investigation at all. Especially if that is a young person, don't go for any unnecessary test. But if a relatively older patient, Okay, for example, more than 25 to 30. I'm using the term relatively older there. If this type of patient develop acne, then investigations are the must. You must find out from where that androgen is coming. Okay, probably it is from the tumors. Some of the tumor may be there inside the body, and we need to search for that. So hormonal assay is important, and at the same time, ultrasonography or CT scan can also be done. Now, just have a look at this picture. This is called Wood's lamp examination of the face. Now, this face has a lot of acne lesion. These are infected lesion. So, when we do Wood's lamp examination, it just change into another color, and we know, okay, this is caused by acne vulgaris or some sort of infection. Now, the final part is the treatment. This treatment part is very important here, okay, because uh, many of our family member, many of our relatives, okay, and the people we know are developing acne, and all the time they ask us the question because they think, okay, you guys are already doctors, isn't it? They think like that, and they ask, can you tell me which medicine should I apply, which medicine should I take, or something like that. So please, after listening this lecture, you can recommend different drug therapy to them. It's not that difficult at all. Okay, so pay attention here. The current consensus recommends a combination of topical retinoid and antimicrobial therapy as first line therapy for almost all patients with acne. So this is a combination therapy, topical retinoid and antimicrobial therapy. The most commonly used antimicrobial therapy is clindamycin. Let's talk a little bit more about it. See here. These retinoids, okay, in the topic of psoriasis also we talk about these retinoids. These are comedolytic. Okay, they are comedolytic, means they dissolve the comedone, and they are anti-inflammatory as well. So they are one of the good drug in this case. They normalize follicular hyperproliferation as well as hyperkeratinization. Now remember, this point is quite important regarding one thing. Uh, if you go to the pathogenesis, the opening of the sebaceous gland should be blocked by those keratin tissue or those flecks. And if these retinoids are controlling that, then this is very good point for the patient. Okay? This is excellent for the patient. Now, they also reduce the number of microcomedones and inflammatory lesion. And this topical retinoid should be initiated as a first line therapy, both in case of comedonal acne and very milder form of acne. For example, comedonal, mild, even moderate type of acne, we can use these drugs as the first line. And these are the different names for you: adapalene, tazarotene, and tretinoin. These are the pharmacological name for these topical retinoids. The trade name may be different, but you don't care about the trade name. Okay, if you remember pharmacological name, it is the patient's job. They find out these proper medicine which you have written. They should go to different pharmaceutical shop and then find it out. One of the important, drawback or side effect of these topical retinoids is sun sensitivity. Okay, they cause burning sensation on the skin where we apply them, and they are applied once a day to clean and dry skin. So we tell the patient first to wash the face very nicely, okay, with clean water, and they don't need to apply any detergent or any soap or nothing like that. Just wash the face and then apply this medicine. Now the second type of drugs, okay, second type of topical therapy here is the topical antibiotic, we should say. Okay, and the most commonly used is clindamycin, I already told you, and less commonly erythromycin. So these days we combine these antimicrobials with topical retinoids. Another drug is also very commonly used along with this antibiotic, that is called benzoyl peroxide. Okay, that is called benzoyl peroxide. You can see it here. This benzoyl peroxide, if we apply it together, it will reduce the likelihood of resistance. Now, that drug is described a little bit better here, benzoyl peroxide. Please remember, this is not benzyl benzoate, okay? Benzyl benzoate is the drug we use in the treatment of scabies. This is benzoyl peroxide. It is anti-acne medicine. So this is also very commonly used along with topical antibiotics or topical retinoids, and it is used once or twice a day. Now, if the acne is very severe, okay, like nodulocystic acne or severe type of acne, we have to go for a systemic antibiotic, and the most commonly used drugs are doxycycline and minocycline. Doxycycline and minocycline, and we have to give them for a long time, maybe month, at least 1 to 2 months. Some of the dermatologists even give them for 3 months. At the same time, if we give this benzoyl peroxide cream as a topical, then it will decrease the emergence of resistant strain of that particular bacteria. Okay, that is Propionibacterium acne. Now there are some side effects of these antibiotics. Remember, they belong to tetracycline group, and tetracycline are considered broad spectrum antibiotic. So a lot of side effects can be there in the patient. So we need to tell them these are the things which you may get. If you get these things, please come quickly to the hospital. One of the side effects is vaginal candidiasis in case of a female, because of the alteration in normal flora. Doxycycline is associated with photosensitivity, and minocycline has been linked to pigment deposition of the skin, mucous membrane, as well as teeth. Now, another type of therapy which we use in case of acne vulgaris is hormonal therapy. Okay, because hormone, androgen, play a big role there. So we give certain types of therapy which antagonizes androgen, and these are estrogen, and estrogens are given in the form of oral contraceptive pills. So this is an important drug. Oral contraceptive pills can be prescribed, especially in case of female. Okay, these drugs are given. Along with that, even spironolactone can be used, because this spironolactone has one more additional function. It binds to the androgen receptor and reduces androgen production. So spironolactone is not naturally used for this. Okay, it is one of the diuretic, potassium sparing diuretic, but this is the additional function of spironolactone. One of the very important drug is isotretinoin. This is a systemically used vitamin A derivative, or you can say a systemic retinoid, which is highly effective in the treatment of severe type of acne vulgaris. Okay, if some patient comes with severe type, we want to use this drug, and it decreases the sebum excretion by 70%. So this is very important drug. At the same time, it normalizes epidermal differentiation. Okay, it normalizes. It is an anti-inflammatory drug. So it is a wonderful drug in the treatment of severe form of acne. It is not given in mild to moderate form. This is reserved for the severe form of acne. Now, this is a non-teratogen, so pregnancy must be excluded before you give this. And after giving this, okay, pregnancy should be avoided as well. So this is also very important, counseling we should do for the patient. Now, there are certain guidelines given by the American Academy of Dermatology. Now, which type of acne we use, which type of medicines or drug, isn't it? There are different stages of acne, like comedonal acne, isn't it? A localized type of acne. Then another one is a more extensive, moderate papulopustular acne, and some others are severe acne. So, which are our choices regarding the treatment? Now, see here. In case of, okay, so let's complete this class. We're talking about the guidelines which are given by American Academy of Dermatology. This is very useful practical information for us. In case of comedonal acne, okay, the most milder form of acne, how we are going to treat? In this case, we prescribe topical retinoids or benzoyl peroxide, okay, any one of them, topical retinoid or benzoyl peroxide. Or you want to use fixed dose combination of adapalene and benzoyl peroxide. That is a combination which is already available. Okay, this is available in different pharmacy. And you can also go for clindamycin and benzoyl peroxide combination. Now this adapalene is a retinoid, topical retinoid, and this clindamycin is antibiotic. So we already talked about this. If you combine benzoyl peroxide with retinoid or with topical antibiotics, it would give even better result. For women, consider combined oral contraceptive. Okay, just now I talked about this. Androgen is the culprit here, so we give certain hormone which will antagonize that. Now, another type of acne which is localized, mild to moderate, localized, mild to moderate type of acne, or papulopustular acne, how we are going to treat. Use benzoyl peroxide as a monotherapy or use topical retinoids as monotherapy. Mono means just single, only those. Or the fixed dose combination of clindamycin as 1% and benzoyl peroxide as 5% and the fixed dose combination of adapalene and benzoyl peroxide as gel or the combination of clindamycin and tretinoin. So different options are there. It depends which option we want to go. Here the concept is important. Okay. Now let's move on. More extensive, moderate papulopustular acne, we have to use a systemic antibiotic now because it is getting more severe. But continue the topical medication as above. Even more serious than that, okay, we want to add combined oral contraceptive pill. In case of female only, oral contraceptive pill are given only for female, not for male. That is important point to understand. And severe acne, the most severe among all, we use isotretinoin as the systemic form. Or we can continue systemic antibiotics in combination with benzoyl peroxide with or without topical retinoid. Now this table is providing you a lot of concept at the end. What have you learned in today's class? Okay, so I want the student to pay attention here quite well. See there. So these are the commonly used drugs on this side. Okay, commonly used drugs, and these are the different functions. Different functions of these drugs. Decreases abnormal follicular keratinization, reduces sebum production, decrease Propionibacterium acne concentration, and reducing inflammation. So just look at this table and tell me which is the most potent or effective drug among all. If I combine all the functions, see that?
Oral isotretinoin.
Exactly. Oral isotretinoin is the most powerful and effective drug. But remember one thing, there is certain indication for the use of this drug. Only in severe type of acne we choose this, because there are some better alternative available for mild type and moderate type. Now at the end we have got certain adjunctive therapy along with this. Okay, now those adjunctive therapy would be comedo expression. Now comedone are black comedone and white comedone, and there is already a little bit dried type of sebum which is blocking the opening of the gland, and we should remove it out. So in many hospitals, or even beauty clinics or something like that, there is a facility of comedo expression. Cyst drainage can be done. Okay, if you drain, the treatment will be faster. Phototherapy can be tried, okay, every day for 4 to 6 months, because it can kill the bacteria. So it has antibacterial property which may help here. Laser therapy, it will target the sebaceous gland and it will decrease sebum production. So laser therapy is also one of the options for us, just one of the options, though it is not very commonly used. And if somebody has developed a disfiguring scar on the face, it doesn't look good at all, so you have to send these patients for plastic surgery. Even dermatologists can do that. These are called dermabrasion and surgical revision, which is properly done by the plastic surgeon, so that that scar would be removed and the overall appearance will look better. So these are called adjunctive therapy. Okay, so all these questions I prepared for you, so please go and solve these on your own. Thank you so much.